Hello, we're going to cover Chapter 7, Axial Skeleton in this. I can't stress enough that we need to spend time not only with the book, your supplemental materials on Blackboard. There's going to be kind of a practice little quiz for yourself of no label brain, other parts of the skeleton, so that you can kind of quiz yourself, colorized, not colorized skeletons. So it'll kind of be a good check for yourself. Spend time in the lab. You can't just look at it one time and then expect to have it down pat. You're going to need to have extra time in the lab to understand and appreciate some of those foramina or bumps and ridges that you just may not see in the book very clearly. Regardless, it's going to take some time. With the axial skeleton, this will kind of be the first part, and we'll finish up next week on Tuesday. So overall, when you think about the skeleton, it's divided up into two portions. The axial skeleton with the skull, auditory ossicles, the hyoid bone, vertebral column, and the thoracic cage, or sometimes referred to as the rib cage. It's also with the axial skeleton, and that's the pectoral and the pelvic girdle that contains the upper and the lower extremities, or the limbs. So realize and review not only there are two portions of it, but go back to Chapter 6 and kind of look at those terminology things like articulations, where bones contact other bones, and landmarks like bone markings or those bumps and ridges, notches, and where it's evidence of muscles or ligaments attaching onto bones. Or the foramina, those are going to be opening for nerves and blood vessels. So the axial skeleton is going to form the longitudinal axis of the body. It really provides a framework that supports and protects the brain, the spinal cord, and the organs of the subdivisions of the ventral body cavity. So it's really going to allow for upright posture that's unique among vertebrates. So we're bipedal, so we walk on our lower extremities, and it's unique that our upright posture allows our hands to manipulate objects, carry a pretty big head, and allow that head to swivel widely. So it has a lot of range of motion to move. But there is some downside to it. The abdominal pelvic organs are exposed and susceptible to injury. If we fall, we could have a concussion, cracked vertebrae, herniation of the intervertebral disc. So again, there are some pros and cons to it, but it allows us to have a lot of those unique features. The skull is going to have 8 cranial bones, 14 facial bones, and that's going to be about our first portion of this lecture. Bones associated with the skull are going to be 6 auditory ossicles, 3 on either side, and those are going to be located within the temporal bones of the cranium. The vertebral column, 24 vertebrae, sacrum and coccyx, and the thoracic cage or rib cage. Those are your 24 ribs and the sternum. So here you can see that the axial skeleton, it makes up about 80 bones of the 206, so it's about 40% of our skeletal structure. Again, if you're very visual, it's all highlighted in yellow, so we're going to talk about this axis or core. Again, 8 cranium, 14 facial, and then the associated bones with the skull is 6 auditory ossicles and 1 hyoid, and I always think about that as kind of like the Adam's apple near the C-spine or the neck. We have 1 sternum, 24 ribs that makes up the thoracic cage, and then the 24 vertebrae, sacrum, and coccyx. That'll make up the 26 in the vertebral column. So be familiar with the colorized and non-colorized versions of our skeleton. Be able to kind of identify these specific areas. So looking at this, you can kind of appreciate the skull and how they are not clearly colorized to kind of individualize the bones of the facial or cranial bones. Again, you can kind of see that we have the vertebral column along the length here. We have the sternum, one of them, that contains the manubrium, the body, and the xiphoid process, so it can be divided up into 3 regions. We have 24 ribs, 12 pairs, and we have 7 true that are attached to their own costal cartilage. And then the remaining are going to be false ribs that are going to be connected up to the cartilage of rib 7, or 11 and 12 are going to be the floating ribs that don't attach to any cartilage at all. And then you also have the sacrum and the coccyx. So, functions of the axial skeleton is basically it's going to support and protect our organs in our body cavities. It's really going to give extensive surface area for the attachment of respiratory muscles that help with swallowing, speech, things like that. Performs respiratory movements, especially with the thoracic cage and how it moves. And then stabilizes parts of the appendicular skeleton, and that's going to be your pectoral and pelvic girdle with the upper and lower limbs. Now, the joints of the axial skeleton overall are going to permit very limited movement, but they're very, very strong. It's heavily reinforced with ligaments. There are bone-to-bone joints. Not a lot of movement, but provides a great deal of stability. Brain, heart and lungs, and again, spinal cord, but you do not have protection for those abdominal pelvic organs. So figure 7.2 will kind of subdivide this out. Remember, the skull protects the brain, entrances to the respiratory and the digestive system. Your cranial bones are going to be the occipital, parietal, frontal, temporal, sphenoid, and ethmoid. Your facial bones are going to be paired maxillary, paired palatine, paired nasal, paired inferior nasal concha, zygomatic bones, lacrimal bones, a vomer, and the mandible. So you can see that most of the facial bones are paired. The 8 cranial bones are going to form the brain case or the cranium, and I consider it the house. It's the chamber that supports the brain. If you remember, I kind of like to compare the cell to a city. If I could compare the skull to something, I would compare it to a building. It's a house. It's the front porch, which is the 14 facial bones, and that protects and supports those entrances to the respiratory and digestive tracts. Again, those cranial bones are going to contain the brain, the fluids, the nerves, the membranes that all help stabilize the position to the inner surface of the skull. Where the facial bones are going to provide more surface area, that's for the muscles that move the eyes, jaws, head. You want to think about the joint between the occipital bone and the first vertebrae helps stabilize the positions of the brain and the spinal cord. So the skull does quite a bit. So when we think about the colorized pictures, I want you to kind of be really on top of the viewpoint that you're looking at. Think about your directional terms. They're coming back here. So if you're thinking about what view you're looking at this, if you said lateral, you would be correct. So let's kind of talk about some of those cranial bones. And I think from the lateral view, you really can appreciate a great deal of the bones that you can see here. So 8 in total. You're going to see frontal. You're going to have paired parietal bones, paired temporal bones, occipital in the posterior view or posterior aspect. You're going to have the sphenoid bone that's kind of like the cross bridge or the keystone bone, and then the ethmoid that's going to make up part of the base and portion of the nasal septum. The lateral view of the facial bones, again, we have superficial facial bones, and those are your maxilla, and again, paired. And those contain your upper teeth. You have your lacrimal bones, portion of your orbit. You have paired nasal bones. You have your zygomatic bones, that's kind of like your cheekbones. And then a singular mandible and a singular vomer. Those deeper bones, again, vomer is going to be one of those. And you're not going to be able to see it here, but it's a portion of your nasal septum, which is your inferior nasal concha. And then with the maxilla making up the palate are your palatine bones. So those superficial bones are the maxilla, lacrimal, nasal, zygomatic, and mandible. These provide areas for muscle attachment that really control facial expression and assist in food manipulation. Remember that some facial muscles attach to the bone, but then they insert on the skin. So again, for speech and facial expression. For example, lots of times during class, during lecture, after I've been doing it for about an hour, see your procerus, this muscle that attaches from the fascia to the skin, and it causes this like little confused look on your face. See it a lot, but again, it's a muscle that attaches directly to skin. The deep facial bones are your palatine, the inferior nasal concha, and vomer. So you might not necessarily see them on a straight on view. You may have to see them in a more interior view. All right, those deep facial bones are going to help separate the oral and the nasal cavities, basically increasing the site of the surface area of nasal cavities or creating the nasal septum. When we talk about sinuses are pretty important. They're air-filled chambers that decrease the weight of the skull. You got to think about the big, large head that you're carrying, and it's just on the cervical bones. And so it's got to support this big, massive head that contains the brain, the membranes, the fluids, the blood vessels. And so you need these cavities to help lighten the load and make the bone weigh less. Inside you're going to find mucous membranes, which will protect the entrances of the respiratory cavity. All right, so again, looking at your views, this is an anterior view. So I want to point out those 8 cranial bones, and you're not going to be able to see all 8 from this anterior view. So you've got the frontal, you have 2 paired parietal bones. Red is going to be your temporal bones, those are going to be paired. Sphenoid is this purple, and then ethmoid is that green. You can kind of see that it does create a portion of that nasal septum. And again, when you are looking towards the back, in the posterior view, you are going to be able to appreciate that occipital bone a lot easier. Now, again, with your superficial and deep facial bones, you're not going to be able to see them all unless you're, looking at the interior. So if you think about the cranial bones as the house containing the brain, this is going to be your front porch situation. So superficial facial bones are the maxilla, and paired, and again you can see that they kind of articulate with the frontal bone, the zygomatic bone. They contain the upper teeth. Good deal. Lacrimal bones, again, are going to be kind of that red area off to the side of the orange, and those are going to be creating portions of the orbit of the eye. You have the paired nasal, so that's kind of like the beginning. So it's like nasal, maxilla, lacrimal bone. And then again, you have the mandible. So definitely very superficial, easily to be seen. And again, the mandible articulates. It's really the only movable joint with the temporal mandibular joint, the TMJ. Contains the lower teeth and allows for, manipulation of food or speech. Deep structures are going to be the palatine bone, and that you won't be able to see here, but you'll see them articulate with the maxilla, the inferior nasal concha, and the vomer. You can see a portion of the vomer right here. Right here. It's kind of like a plow looking maneuver. And then the inferior nasal concha, you can see it in the colorized version. You don't really see it that well in the plastic skulls. So just kind of take your time and look at those features on both. I think it's best to look at the colorized version first and then look at the non-colorized version and kind of quiz yourself there. So at the posterior view, you're going to see the occipital bone, paired parietal bones, paired temporal bones. You can kind of feel that external occipital protuberance, and you're going to see the back portion of the mandible, but only seeing it with the removal of the vertebral column. One thing of note here is you can see the occipital condyles, and those are going to articulate with cervical vertebrae 1, the atlas, and allow for head motion. Another thing to note out here is some of our sutural lines. So suturals, again, are going to be the immovable joints of the skull. And anytime I say joint or articulation, it's basically where two bones interconnect or move. And so again, really in the skull, they're going to be mostly immovable joints, except at the mandible that contacts the temporal bone. And again, those are going to be movable joints, but these sutural lines are going to be immovable. They are fixed firmly to the bone by dense, fibrous connective tissue. Here we are talking about connective tissue again, so it's a tight interlock. And we have 4 major sutures. We have the coronal suture, going back to here. And so that coronal suture kind of divides, if you think about divisions of the body, being able to divide the body into an anterior and posterior portion. So this coronal suture divides the frontal bone from the paired parietal bones. A sagittal cut, or a sagittal line, or this sagittal suture, is going to kind of divide our body into left and right. So we have a left and right parietal bone. They articulate with the parietal bones. The lambdoid suture is going to be found on the posterior view, and it's going to kind of divide the parietal bones from the occipital bones. And the squamous suture is going to be kind of more on the side view of the skull, or the lateral view, and it's going to form the boundaries between the temporal bones and the parietal bones. But you can see that it coincides a little bit with that lambdoid suture. So, again, just to kind of clarify the sutures, remember, the boundaries of the skull are immovable joints. You have the coronal that cut through the body to produce a frontal or a coronal section, attaches the frontal bone to the 2 parietal bones. The lambdoid suture on the posterior surface of the skull will separate the occipital bone from the 2 parietal bones. Sagittal suture cut along midline of the sagittal suture, it will produce the mid-sagittal section. So basically you get this like left and right cut. And it's between the two parietal bones. And then the squamous suture from the side view is going to connect the temporal and the parietal bones. Fabulous. Now this is where the mandible has kind of been removed off. You've turned the skull upside down, so this is an inferior view. So again, be able to appreciate from top to bottom, side to side, front to back, because I want you to think about the skull as a three-dimensional object. So here, if this is an inferior view, remember what is anterior, what is posterior. So be able to appreciate that even though you're viewing something from a different angle, be able to identify certain landmarks that will help you say what is front and what is back. So frontal bone, if you see teeth, you can kind of be sure that the frontal bone is going to be to the more anterior and the occipital bone is going to be towards the posterior. You can see portions of the cheekbones here with the zygomatic bone and the temporal bone with those two different processes. You can appreciate the maxilla. So it contains the upper teeth and the two paired palatine bones. You can also appreciate the vomer, creating a portion of the nasal septum, that lower portion. You can see the keystone bone of the sphenoid bone, that purple one. You can appreciate more of the foramina that you see here exiting out. So anywhere you see a foramen, it's going to be an opening for nerves, vessels, etc. to come out. Carotid canal, so it's going to have the internal carotids. You're going to see the foramen magnum as an exit for the brainstem. The jugular foramen, you're going to see the jugular veins here. Foramen ovale, this is an exit for one of your cranial nerves that feed the sensation of the face. So again, a lot of different areas and structures to review, go over, and re-go over. So this lateral view, I think, is the best view to kind of like see the whole picture. 8 cranial bones, and again, these will make up your calvarium. Basically, the occipital, parietal, and frontal bones. Appreciate there may be sutural bones located within the lines of the sutures. Typically, you see them most along the lambdoid suture. Squamous suture you can see very clearly dividing the temporal and the parietal bones, but kind of seeing them intersect with the occipital bone with that lambdoid suture. Again, you can appreciate more of the bones of the orbit of the eye, frontal, nasal, maxilla, lacrimal, the smaller one right there, the ethmoid, portions of the sphenoid bone, and the zygomatic bone. In the interior view, be able to appreciate this sagittal section through the skull, so like at the sagittal suture, I kind of divided it down. And so you can kind of appreciate more of the keystone feature of the ethmoid bone, kind of giving that support and base for all of the other bones. Again, frontal bone, parietal bone, red is going to be temporal bone, and the occipital bone back through here. In the front, you're going to have the maxilla bone, so kind of cut away, you won't be able to appreciate, but still it's the bone with the upper teeth. The maxilla. You're going to have the lacrimal bones that you're not going to be able to see, the nasal bone that you're not really going to be able to see except for just this tiny little bit, and then you see the portion of the mandible with the lower bones. Those deep bones, palatine, are going to be these small little bits connecting to the maxilla. You're going to have portions of the vomer, the lower nasal septum, And then you're also going to have the inferior nasal concha. You're not going to be able to appreciate it much here at all. Other things to note are the sinuses. So you can see the frontal sinuses right here, sphenoidal sinuses. So anything that will help make the skull lots less heavy. Other things to see is appreciate when we drew out the foramen and kind of the areas there. You can kind of appreciate more of these cranial fossas, the anterior cranial fossa, the middle cranial fossa, and then the posterior cranial fossa. So it kind of fits all the way in here. Perfect. So in here, superior view, but it is a transverse cut. So here you can kind of see they've cut the skull in a top to bottom, so it's a transverse horizontal cut, but this is the superior view, so you're looking down in it. So I think this is a really good image to look at when you're learning your foramen, so that you can kind of really get it down pat, be able to refer back to these images so that you can feel confident in finding these structures, because it's gonna help. So in the anterior portion, you're going to see the ethmoid bone with the crista galli and the cribriform plate that's going to contain the olfactory receptors, or the olfactory nerve, cranial nerve 1. In the middle, so this purple and red region, are going to be areas for the optic canal, really kind of by the lesser wing of the sphenoid. So it's going to kind of be tucked away, so you really need to look at the model to appreciate that. You're going to see something called like the superior orbital fissure covered by the wings of the lesser wings of the sphenoid. You're going to see the ROS, foramen rotundum, foramen ovale, foramen spinosum, right there. So again, the first one is going to be foramen rotundum, foramen ovale, and foramen spinosum. And then in the more medial, you're going to see foramen lacerum and the carotid canal. Hopefully you will definitely see the foramen magnum in the posterior cranial fossa. Flanked by that, you're going to see a tiny little bone, or tiny little foramen off to the side of it, hypoglossal canal. And then between the temporal and the occipital bones, you're going to see something called the jugular foramen. Again, practice, look over. So we talked about the sutures, those immovable joints of the skull, 4 major: lambdoid, coronal, sagittal, and squamous. So this is a superior view, so you can see occipital bone in the back, lambdoid, sagittal suture, coronal suture, but from the lateral you're going to see this squamous. Right here. Great. 8 cranial bones: occipital, parietal, frontal, temporal, sphenoid, and ethmoid. So hopefully we'll be able to kind of go through these a little bit quicker now that we've kind of talked about the location and kind of more of the finer details. Starting with the occipital bone. So in this view, you can kind of appreciate more of the disarticulated effects of the cranial bones. So frontal bone, paired parietal bones, temporal bones, sphenoid, ethmoid. And we're going to start with the occipital, this purple bone in the back. So functions of the occipital bone are going to be the posterior inferior surface of the cranium. It's going to articulate with a couple of different bones, but particularly the first cervical vertebrae, the atlas. Marks that you want to kind of make of note here is the external occipital protuberance, the small bump at the midline at the inferior surface. So again, anytime you see these bumped areas or raised areas, those are going to be areas where ligaments or muscles are going to attach. You are going to have the foramen magnum that connects the cranial and spinal cavities by the vertebral canal. which is enclosed by the vertebral column. You're also going to see the hypoglossal canal, and that begins at the lateral base of each occipital condyle, and it ends on the inner surface of the occipital bone near the foramen magnum. So it's kind of harder to see until you kind of get that pipe cleaner through it. And so these occipital condyles right here and here are going to articulate with cervical vertebrae 1. And that's going to articulate with the neck for that yes position. So appreciate these features by themselves, but also appreciate the occipital bone as a whole. All right. Here you can see the foramen magnum, the hypoglossal canal, and then lastly is the jugular foramen. And again, the jugular foramen is going to be between the occipital and the temporal bone for the jugular vein. Carries venous blood away from the brain. Basically, it's going to drain the blood that passes through this back to the heart. So I think when you think about the occipital bone, maybe the inferior view is going to be the best view. It gives you a good illustration of that intramembranous ossification. So how it's like that flat bone and kind of spreads out. We talked about that. External occipital protuberance, the occipital condyles, foramen magnum, jugular foramen, hypoglossal canals. So all of these are going to be found on your structure sheet, and those are all your responsibility for lab. Parietal bones basically forms the superior and lateral surfaces of the cranium. Two paired parietal bones. Forms the wall. So basically, if you think about the parietal membrane, it covers the wall of the body cavity. So you can think of the parietal bone as the wall of the cranium. Articulates with the other parietal bone, occipital, temporal, fonal bone, and sphenoid. So it's a connecting bone. Not much to it. Basically, the superior and inferior temporal line. And these are ridges that mark the attachment of a muscle called the temporalis. And basically that temporalis muscle will kind of connect from here onto the mandible, and it'll help close the mouth. And there are grooves for cranial nerves on the inner surface. Frontal bones are going to be the anterior cranium and the upper eye sockets. So basically it creates the forehead, and it has the frontal eye sockets. And again, sinuses are air-filled sinuses that have mucus secretions to help flush the surfaces of the nasal cavities. And again, lots of articulations. Marks of the frontal bone. So if you were to be playing ball and you got hit in the forehead, it would probably hit near this frontal squama. Again, it creates the roof of the orbit, so you'll see a superior orbital margin, and you'll see these frontal sinuses. So this frontal squama is kind of right here, right in the middle of the forehead, and then you'll see this margin for the roof of the orbit. Here in this inferior or orbital surface, you can appreciate more of these sinuses, so air-filled, meant to be air-filled cavities. And then you can see this, more of this ridge of the orbit, the roof of the orbit. Fantastic, we're getting through it. Temporal bones. Again, temporal bones are going to be the lateral walls of the cranium and the zygomatic arches, a part of the cheekbones. It's the only articulation with the mandible. It surrounds and protects the sense organs of the inner ear, and it attaches the muscles of the jaw to close them and to move the head. Lots of articulations, and marks of the temporal bone are going to be a squamous and a petrous part. So it's going to be the inferior surface, kind of near the squamous suture, And then the petrous part is going to contain the inner ear, the sense organs, those ossicles, more sensitive and need to be protected parts. You also have the mandibular fossa. That's at the inferior surface, and it articulates with the mandible. It's that little depression to articulate with the condyle with the mandible. You have the mastoid and the styloid process, so that rounded bump. It's very easy to palpate. Mastoid is a root word for breast-like shape. And it provides muscle attachment to rotate or extend the head. The zygomatic process will create part of the cheekbone. And again, the auditory ossicles are 3 tiny bones in the middle ear that lead to the inner ear. So it helps transfer sound, like vibrations, physical, to the delicate tympanic membrane, to the eardrum. So it kind of takes these like movement and turns it into a neural information for sound. And again, these are housed within the petrous part for the inner ear. Gives us information about hearing, balance. And so again, you have to think about that squamous part and the petrous part being a relationship to the ear. So when you see that external acoustic meatus, that ends at the tympanic membrane, which leads to the middle ear. The middle ear is going to be located within the petrous part, and the inner ear is going to be kind of even further to protect those sense organs that provide the information about balance and hearing specifically. Again, we have air cells, sinuses that connect to the tympanic membrane to help lighten the load. So again, squamous part, the zygomatic arch will be portioned of the zygomatic process to make the cheekbone that will articulate with the temporal process of the zygomatic bone. 2 portions to make the cheekbone. And the mandibular fossa will articulate with the mandible. Mastoid process for muscle attachment to basically rotate and extend the neck. Styloid process that will connect tendons and ligaments to the hyoid, tongue, and pharynx. And then the petrous part is going to close structures of the inner ear. Talked about that. And then the foramina. So the foramina is going to be quite a few. So when you look at these, the carotid canal and the foramen lacerum are going to be kind of closely together. The carotid canal is going to be for the internal carotid artery, and that's going to be really by the styloid process. So it travels posterior and laterally. The foramen lacerum is basically this jagged little slit between the sphenoid and the petrous portion of the temporal bone for the carotid and the small arteries. It's really covered by hyaline cartilage, and it has kind of near the auditory tube. Again, the large hole is going to be the external acoustic meatus that ends at the tympanic membrane. The styloid mastoid foramen is going to be posterior to the base of the styloid process for the facial nerve. It's a cranial nerve. And the internal acoustic meatus, again found on the interior view, it's at the medial surface of the petrous part, contains blood vessels and nerves for the inner ear, and also contains the beginnings of the facial nerve where the styloid mastoid foramen is going to have its exit. So again, really be comfortable with looking at the images of the book and then translating that to models, non-colorized versions. Our next bone that we're going to cover is the keystone bone, the sphenoid. Here you can kind of see the squamous part, the flatter part. It's kind of irregular shaped. And then the petrous part here, where you're going to have the internal acoustic meatus that's going to be on the medial surface of the petrous part contains the blood vessels, nerves of the inner ear, and then the middle ear is going to be like located within this petrous part near the tympanic membrane through the eardrum. And so again, it's going to close structures of the internal ear. And again, the external acoustic meatus is going to end at that tympanic membrane, which leads to this portion. And you can see that right here. So this is on the outside. So this is the lateral view. So you get the internal acoustic meatus, tympanic membrane, middle ear within the petrous portion, going to the inner ear where the sense organs are at. You can see the zygomatic process of the temporal bone, and you can see this depression mandibular fossa right here. You can appreciate the styloid process and mastoid process, and so you're going to see the styloid mastoid process in between those two. Sphenoid. It's going to be wedge-shaped. It's wedged between the cranial and the facial bones, and so it looks like a bat with wings extended. It basically makes up the floor of the cranium, unites the cranial and facial bones, acts as a cross brace to help strengthen the sides of the skull, and also contains sphenoidal sinuses to help clean up the surfaces of the nasal cavities. But really hard to appreciate because it's covered by the more superficial bones of the cranium. Multiple articulations, and some marks to see are the sphenoid body, sinuses, sella turcica, greater and lesser wings. The sphenoid body is going to be the central axis of the sphenoid. The sella turcica, they kind of refer to it as the Turkish saddle. So it's kind of like this characteristic saddle-shaped enclosure with a high back and a extended front that contains the pituitary gland. So it's located within the hypophyseal fossa. So basically, hypophysis means to grow beneath the brain, which is protected into the sella turcica. The sphenoidal sinuses are on either side, and they're inferior to the sella turcica. The lesser wings are anterior to the sella turcica, and the greater wings form the cranial floor. They extend laterally from the body, where the lesser wings will extend horizontally. Now the sphenoidal spine is going to kind of be posterior, but anteriorly will contribute to the posterior wall of the orbit. Foramen that you're going to be looking for are the optic canals beneath the lesser wing for the optic nerves to go from the eyes to the brain. The superior orbital fissure, the foramen rotundum, the avale, and spinosum all penetrate the greater wing. So the superior orbital fissure is going to contain blood vessels and nerves of the orbit. Foramen rotundum are going to be blood vessels and nerves of the face with the ovale. So rotundum is going to be kind of more of the forehead. Ovale is going to be kind of the middle part of the face near the cheeks. And spinosum are for these smaller blood vessels and nerves of the jaw. Fabulous. So again, kind of a bat-shaped wing, body, lesser wing, greater wings. You can see that the lesser wings, you'll have the optic canal, and beneath it you'll see the superior orbital fissure. So you can kind of see that the lesser wing is kind of hiding it. You'll see the foramen rotundum, foramen ovale, foramen spinosum. So think about ROS, OS-ROS, optic canal, superior orbital fissure, rotundum, ovale, spinosum. Sella turcica here, and inside you'll see the pituitary gland. You'll appreciate the large sphenoidal sinuses, and you can appreciate more of the superior orbital fissure here. So again, hidden by those lesser wings. So this is the anterior view. you'll have these pterygoid processes extended down too. Ooh, those are going to be vertical projections that originate on either side. And they basically, it's a place to attach muscles of the lower jaw and soft palate. Ethmoid is going to basically be the anterior medial floor near the cranium. It's going to be the roof of the nasal cavity and part of the nasal septum and the medial orbital wall. Also contains a network of sinuses, ethmoid air cells, to flush the surfaces of the nasal cavities. This bone is very difficult to visualize in an intact skull. So again, you can appreciate that case in the lab with the disarticulated skull. But again, imagine the ethmoid as a capital letter T. So your vertical hand is your perpendicular plate. The knuckles are the crista galli, and the tips of the fingers are the two lateral masses. The cripiform plate is going to be the floor of the cranium. It's basically anterior, more medial, contains the crista galli, and basically a very large structure called the falx cerebri. It's basically a ligament that helps attach to the brain. So it projects superior to the cripiform plate. They call it the crista galli because it looks like the cock's comb. You have two lateral masses containing the air cells that open into the nasal cavity, and it also has the superior and middle nasal concha. These are very delicate projections that break up the airflow in the nasal cavity, can create swirls, turbulence, with three major functions. Sticks to mucus, slows air movement to warm it, and move to olfactory receptors. And then the last portion, most posterior portion, is the perpendicular plate. It's part of the nasal septum. So you get a deviated septum from this chronic sinus problems here. And it works with the vomer and the hyaline cartilage to make up the nose. So again, articulations of the ethmoid are quite a few, and you have the olfactory foramina in the cripiform plate for the olfactory nerves. So, most posterior is going to be the perpendicular plate. You have two lateral masses for this ethmoidal labyrinth of air cells, olfactory foramina for the olfactory nerves, and then the crista galli to help adhere the brain down to the frontal. Again, you have the superior and nasal concha, middle nasal concha, and those are just those little projections that help create turbulence for airflow, stick to mucus, and then the perpendicular plate is going to create portions of your nasal septum. I think we'll quit right here, and we'll talk about the facial bones of the skull, vertebrae, thoracic cage for the rest of the lecture here. Thank y'all.